So my name is Millie Zimmerter, and I'm Head of Public Policy here at the Open Data Institute. And I'm delighted to be joined by Dr. Silvia Muyungo, who is a biostatistician with the African Population and Health Research Centre, by Dr. Stevanos Wisnuwijaya, who is Director of Research and Innovation at Universitas Prasetya Mulia in Indonesia, and also by Professor Roland Iles, who is the founding director of the Centre for Digital Health at Berlin Institute of Health. So we've got this esteemed international panel here to discuss aspects of pandemic data for global disease surveillance. And I think Charlotte's now joining us. Is that correct? Charlotte, are you here? Yes, you are. Okay. Well then, let me introduce Charlotte, who we're really lucky to have with us today, and then I'll hand over. So Charlotte Watts is Chief Scientific Advisor for the Foreign and Common Development Office of the UK government, and we're really honoured to have her here today. So Charlotte, I'm going to hand over to you to introduce the topic. Thank you very much.
Great, thank you. Can I just check people can hear me after all the technological challenge I've had getting in? I just want to hear you, check you can hear me. Can you hear me okay? Can somebody put a thumbs up? Brilliant. Okay, so welcome. It's really lovely to be here, and apologies for some of the issues in getting in. It is really my pleasure to be here to be part of this and chair this really important discussion around global surveillance. This is an area that the UK is extremely interested in, and we're very keen to hear from the lessons from our esteemed panelists that have already been introduced. So just to give you a sense of how it's going to work, we are going to have some guiding questions that I'm going to ask each of our panelists. We aren't going to have Q&A, but I really do encourage everybody to use the chat because we'll be wanting to collect comments, feedback, and also in particular also have links to any particular resources that you may want to share during the discussion with the speakers and with ourselves. As part of that, we will then be able to follow up and on those different suggestions that you can give in. At the end of the session, also the ODI Summit team will share a briefing pack with a bit more information about the work that the Global Pandemic Data Alliance, of which ODI is the member, will be doing. And this has been convened under the UK's presidency of the G7 this year. To kick off, firstly, just for people who may not be aware of what the Global Pandemic Data Alliance is, as part of the G7, the UK invited the Data Alliance to help drive the implementation of some of the work identified under the health track of the G7. And the Data Alliance consists of a number of organisations: IDARE, the Open Data Institute, the Royal Society, and the Trinity Challenge. And it's very much open to others. And we're hoping that part of this event will bring others on board as well. In terms of this panel, it's a starter really to understand the efforts and think about the issues that need to be undertaken and activities need to be undertaken to improve data preparedness for future pandemics around the world. In particular, the focus of today is on global disease surveillance. The importance of surveillance is critical to ensure that we have the right global health data. And this is something that's come to particular predominance clearly after C-19, but as an issue, I think having worked in global health for many years, is an issue that we've been aware of for many, many years. I think what I'm hoping that we're going to get from the session today is a chance to really reflect, well, what does that mean in practice? What is that focus? And where are great examples that we can learn from? I mean, for example, when I think about surveillance, what do we mean by that? Does it mean that do we have the global system to spot the emergence of a new or unusual disease? Or does it mean that we have the data systems to investigate further when something does happen that might be unusual or unexpected or an issue of concern? Or does it mean, do we have the systems to ensure that any new outbreak can be nipped in the bud, or that the drivers of that outbreak can be quickly understood, or that the particular genetic sequencing or clinical features that particular manifestation is rapidly assessed, and that information is shared and distributed. There's lots of ways when we think about surveillance that lots of issues that we could be thinking about, and capabilities that we could be thinking about need to be strengthened and expanded as we look forward. And clearly there are also broader issues around data ownership, data access, who needs that information, who can access that information, and how ultimately will that information be used for the global good. So with that, I'm going to now move on to the session and the great speakers that we have today, who are going to share some of their reflections on these topics. So I'm going to kick off and give each speaker an opportunity to talk about where are we currently with data for the global pandemic response. And I'm particularly keen to hear from each speaker about their experiences of pandemic response from their work in their particular settings, but also I hope draw out some of the international insights and relevance of their learning and experience from their different the settings in which they work. So first, I'm going to hand over to Professor Ellis to ask him to give his thoughts on how would you describe the current status of data infrastructure and capabilities for pandemic response. So over to you, Roland.
Yeah, thank you. Very nice introduction of the topic. So I try to think in terms of the ongoing pandemic. I think we are pretty much nationally if it comes to aggregation and integration of demographic data in a more active fashion. Now, if it comes to more focal infection or to trace infection traces, I think we are less well equipped. Now, so I think what is required here is certainly, and I think we will come to this later in the discussion, is that there are a lot of regulatory issues around sharing data if it comes to more fine-grained, let alone individualized data, which you would like to share across institutions, regions, nations, and states. And secondly, I think we should consider most rigorously sharing data, which gives us better also molecular characterization of the diseases we are handling with, confronted with. I think UK has been a front runner in organizing, for example, massive scale genomic characterization of different strains, which are kind of evolving out of the present SARS-CoV-2 virus, which I think is very important to develop and establish an early warning system, so to speak, for new variants of the virus, which needs to be known internationally and also needs to be, for example, the international community, which are producing countermeasures like vaccines and so forth. And secondly, I think we are even much less prepared if it comes to assessing the level of immunity of a given individual, a given nation, or a given region internationally. And I think here it would be extremely interesting and important to get a very straightforward and simple answer to a very simple question. What does it mean to, and what does it take that an individual is characterized as immunized against, in this case, SARS-CoV-2 virus infection? And I think the data in principle would be there if we were willing to collect and aggregate and share the data internationally, but certainly there's a lot of work to be done to get to this point.
Great, thanks, Roland. Really a range of really important points, both around sharing, around regulation, around the breadth of information that is important. Sylvia, I'm going to hand over to you next. From your experience of working in the African Population Health Research Centre in Kenya, what are your reflections on the current situation? How well are we doing? Over to you.
Yeah, thanks, Charlotte. So I'll talk about two aspects or work stream projects that we are currently undertaking, and one of them is tracking COVID-19 data within the WHO Afro region, and then the other one is looking at developing a hub for COVID-19 data using 2 use cases in Kenya and Malawi, and what the practical or implementation experience has been in that space. So in terms of the tracking, early on in the epidemic, it was very clear that there was a lack of systems to gather this data. And when the data became available, the data was not disaggregated by sex. So it was difficult to inform public health response in a sense. So even now, I think by the middle of June, many countries started collecting sex disaggregated data. And then we still have countries that are publicly reporting data that is not disaggregated in that sense. And that presents a missed opportunity for effective response in terms of who needs access to preventive care or who needs services in that sense. And then the other one is to do with the gathering data through a hub. And what we realized there is that most people within, especially in the low middle income setting, do not use hospitals. So much as we are collecting data, population health data, and we need public population level data and public health data. And not just health data, but also environmental data. So gathering systems to do that and collecting data to do with the environment, because the people live in the environment and it affects the way they respond to the current situations with the pandemic or social impacts that it might have. So on top of that, we realized that we need to build gender and sensitivities within the data that we collect, because that helps us to address issues around whether access to vaccines is equitable, or we need to ensure that the people who are affected actually can access services or preventive care or information if they need it, especially within the current situation, given that governments are diverting resources from different places and people cannot access all the necessary services at this point. So having a system that ensures that gender and sensitivity or intersectionalities who makes, especially in our setting, given our norms around decision making in a home and other aspects, women being employed over 70% in the informal sector and being the main caregivers, all have impacts on how we respond. Thank you.
Great, thank you. And really important points about gender, that disaggregation to really inform that response. It's rather sad, for so many years we've been talking about the need in health for gender disaggregated data. And it's still an issue that clearly, and when we're thinking about future surveillance, we have to pay attention to, not only to understand vulnerabilities, but also to get a sense of who actually is accessing services. Are we achieving inclusivity in the response, and ensuring that the response is meaningful and benefits everybody? So important points. Thank you, Sylvia. Okay, next over to Wisnu. Could you tell us what the situation feels like in Indonesia? Do some of the points made by others resonate with you, and what has been your experience of data infrastructure and the capabilities for pandemic response?
Yes, thank you, Professor Charlotte. Now, currently, data is the core at the narrative of this pandemic right now, and people want to know about the pandemic data. And in Twitter, conversations are dominated by people request to those informations, and absolutely in the official governmental accounts which responsible to distribute this information are very popular. It is mentioned frequently in Indonesia. They want to know about data, pandemic data, about the total case, how the vaccination is working well. They request about this data. This data is distributed widely through social media, and it is absolutely effect to what we think and also what we feel. Data shapes how the government dynamically respond to this pandemic, and also it shapes how people views the pandemics. Data also influence how people conduct their daily activities while still maintaining their economic activities. Data is very important. However, we still have a challenge, especially in digital infrastructure, because it is a challenge. Digital infrastructure is a key to generate a good quality of data. In addition, we also need a good data governance and also a good human resource who are aware about a good quality of data. It is what I'm thinking right now.
Great, thank you. And I really love your points about actually, despite some of the issues others have spoken about, there's this huge interest in data, just as you say, at the public level to inform decision making, and we need to take advantage of that opportunity, but also recognize what are the capabilities, what's the ways we govern and manage that data. So thank you, a really nice complementary perspective. Okay, I'm now going to move on to my second question, which is about, based on your different experiences, where do you think the world should be heading in terms of global data for disease surveillance for pandemic response? And please, bring in any examples that you might have, but what would an ideal scenario look like? What is the vision that we should all be aiming for, taking advantage actually of the recognized urgency of this issue, but also the enthusiasm around data that I think we're all seeing and in our respective lives. So Sylvia, if you don't mind, is it okay if I go to you first?
Yeah, thanks, Charlotte. So I think where we should be going should really try to look at building integrated health systems. So in terms of having an effective response to future or global, whether it's disease or pandemics, especially in low middle income countries, is building these health systems that support the response to whether it's public health or a threat, or to responding to other needs that arise because of not just outbreaks, but even in normal situations where we don't have a pandemic, but we need to address issues effectively. So the opportunity that I see we have is we have some demographic health systems We have surveys, data from surveys. And then what I think we should look at is actually involving citizens in this process. So much of the work around the pandemic scheme has shown that we could, the absence of physical presence in many areas shows that we could take advantage of the developments in artificial intelligence or data science or other means, but also involve citizens as beneficiaries of the system to gather this data, not just to speak about it, but to gather and to be informed. Because one of the things that broke down early on in the epidemic was the lack of information within, and then that's still eminent in the vaccine response, or with regards to the efforts to step up vaccinations. Thank you.
Thank you, and great points. Okay, over to you now, Wisnu. What should our vision be?
Yes, I agree that we need a good digital infrastructure to provide a high quality of big data, as we need a good data governance too, and also high quality of human resource. But in addition to that, I think that providing a quality of data also need providing a comprehensive information which is culturally accepted by people and also positively affecting the people. On the other words, it should be minimize the anxiety of the people so they can view the world positively. We can enhance their positivism. I think it is very important. So not just providing a good digital infrastructure, but we also need to have a research, to conduct a research, and also to educate people about data and information. Because a good digital infrastructure means that we can spread or distribute a good information to widely, but also it is a way of misinformation distributed to the people. So education is very important in this context.
Great.
Thank you, Prof. Gerald.
Great, thank you. And I love your points around it's data that can be used and used by the people, and we need that support for the good use of data and the risks of misinformation that again is an issue that many of us have been struggling with as part of this current pandemic. And then next, Roland, what's your vision?
Yeah, okay, let's dream up the perfect world. So in
Go on.
terms of pandemic preparedness, it would be perfect if all data coming out of each lab testing system everywhere in the world would be readily connected to each and every single electronic health record data item which is being collected. And then all of this information is readily and freely shared across national borders and can be used and utilized by everybody for any purpose. Of course, if we put this level of expectation that high, there's a long way to go. So to be a little bit more pragmatic, I think it would be very helpful, and I think Wisnu and also Sylvia pointed out to this in this direction, to better make use of existing data which you have collected over the ongoing pandemic, because I think we could learn a lot in terms of retrospective analysis of the existing data if we only brought them together at large scale. nationally and internationally, we could learn much better what are the determining factors which actually drives vulnerabilities, for example, to infection, which describes a pandemic situation, which are most critical in the pandemic dynamics and so forth. And I think that will help us to better understand which kind of data we need to collect prospectively for being better prepared for future pandemics. And I think that will help us to lower the barrier of in terms of better understanding which kind of data is best has the best potential to help us to identify early on disease and infectious disease outbreaks nationally and internationally.
Great, thanks, Roland, and I love that big ambition, but also look, let's make sure we're learning retrospectively from what we've done now and what were the gaps and what would we do differently next time. A lovely combination of suggestions. So, okay, the last round of questions, which is, we've been dreaming big, but just to end with, I would love to get each of your thoughts on some of the concrete steps that we should be taking to move in the right direction, and particularly, in one sentence, 2 sentences, what would be your top ask of the global community right now in regards to moving forward on this topic? So we're going to do a quick fire round of responses. Wisnu, do you mind going first this time?
Okay, Professor Charlotte. I'm thinking that we need to enhance our education in data for people. It is very important because we are not talking about data itself, but how data can be accepted by people positively, and data can affect the people positively. I think it is very important right now. Thank you, Professor Charlotte.
Thank you. Roland.
Yeah, picking up on what I said earlier, I think it would be extremely important to have access to large-scale data from the retrospective data which we have collected nationally, internationally in the ongoing pandemic. And we all know that there are a lot of regulatory issues around if it comes to sharing data nationally, internationally at such a scale. One way to overcome this is, and I think we should invest a lot of more thinking into this, to put the citizen right into the center of decision making, which kind of data should be shared for which purpose, with which institutions, organizations, companies, and so forth. And I think if we take away the control of data flow away from a national regulatory level down to the individual level, I think we can get reach 2 goals at the same time. Number one, what Vishnu actually pointed out to, that people are better informed and involved, and think and believe and learn that they can take an active role in combating an epidemic or pandemic. And secondly, it will help us hopefully also to be able to share and collect and share data at larger scale without too many regulatory additional burden.
Great, thank you. And Sylvia.
Yeah, thanks, Charlotte. And I totally agree. I think from the experience we have, thinking about how do we empower governments to use their data to inform policy better, and then strengthen capacity to support good or harmonization of data systems across the different domains. Plus, I think one of the critical things I think comes up every time we have to talk about public health response to this pandemic is buy-in from government. Actually, that has been really critical. Buy-in from governments, that is thinking about the issues with data that Roland and Wisney mentioned, developing this trust and respect for ethical use of data is really critical. Yeah.
Right.
Thank you.
Thank you. So brilliant set of insights and contributions and asks, and I love the breadth of the scope of topics that we've covered in such a brief time. I mean, just a few reflections. What's coming out really strongly for me is just how much we need data, and it's data to inform action. And it's multiple sources of data, but that centrality of how do you get the data into the format of the join up, that it really informs action, be it by communities, be it by policy makers, that this important element about capability. How do we build that capability to use data, to generate data, to own data? But there's also clearly important issues around responsibilities, around the ethics of sharing data, as well as the opportunities of that, and getting the regulatory systems, the coherence between data sets are important aspects of that. Clearly there's huge opportunities ahead for us to do more. There's huge need for us to do more, and that is both related to the current pandemic, but also looking forward to future pandemic risks, and also to help us deal with other non-pandemic disease threats, that using data in real time will keep our systems alive and mean that it will serve a purpose. There's clearly, I think, a lot of lessons that we should and need to learn, and we can do that now, and we can do that both retrospectively, but also should be applying the lessons learned prospectively. And there's much more to do for us to actually get to that global system of surveillance that we all aspire to, and that you each talk to in very passionate ways. So thank you, everybody, all our panelists. Thank you, everybody who's joined. The ODI Summit team are now posting in the chat a briefing pack about the Global Pandemic Data Alliance and how you can get involved. So really do encourage you to get involved. And the first activity is mapping the current landscape and thinking about future data infrastructures and principles. And there's also funding available for collaboration opportunities across the Alliance. So please do join. You're also warmly welcome to join the coffee lounge now for networking and to meet the speakers and continue the conversation here. So thank you, everybody, for joining. And my particular thanks go to all of our great speakers today. Thanks.
Thank you. Good.
Thank you.
Thanks,
Great.
everyone.
That was brilliant. Lovely set of issues. Thank you.
Thank you.
So we are now assumed just to leave, right?
I think so.
I think so.
Take
Okay.
care.
Just leave.
I hope we're not.
Yeah. Just leave.
Yeah.
So he said something like it will automatically go off. So I'm hoping. Yeah. Thanks.
Okay, I'm just leaving, and
Yeah.
and
Anyway,
great
lovely to meet you all, and I hope we continue this conversation in other formats.
Thank you.
Yeah.
Nice to meet you too.
Thank you, Charlotte, Sylvia. Selamat sore, Pak Roland.
Bye.
Terima kasih.
Bye.
Bye.
Bye. Thank you.